All right, Joe, I might just get us started. Welcome, everyone. Thanks for joining us for another town hall session. Tonight, Joanne Lubicic, our Executive Director, will be presenting on the Ontario Government Step 3 regulations of the Roadmap to Reopening Plan. We're finally talking about more positive times and things during this pandemic. So our sport's back, both indoors and out, and we could not be more excited. Just a few reminders, all participants are muted, so type any questions that you have in the chat box. We will work our way through them either during the presentation or at the end, kind of wherever they fit best. These questions will be turned into an FAQ and we will post them on our website. As you just heard, we're also recording this session and we'll be posting it to the OVA YouTube channel tomorrow. So anyone can review it, share it with your club members and so forth. We'll also be posting the slide deck from tonight because there is a lot of information in here. And I think that's it for me. I'm just running through my list. But anyways, without further ado, Joanne, I will pass it off to you.
Thank you. Yes, we will get us going because we have a lot of information to share. As Alicia said, we're excited to be in step 3 and that sport is back. But there is still lots of requirements to keep us going and to keep sport going and to keep participants safe. So I will jump on into it. And as Alicia said, please ask questions and we will get to them and answer what we can and what we do know. So we're going to go through just briefly the roadmap of Ontario. As we know, we're in step 3. We have a little bit to say about the Ontario supporting Ontario's Recovery Act. And then we'll get into the details of volleyball's return to play, which now includes indoor, and jump into some questions. And we have some future town halls scheduled for you as we continue to keep you updated on lots of information. We are in step 3. So this is super exciting as now indoor can happen. So the biggest impact here is obviously that we can now have some indoor volleyball, and really all sport is in action. So even our MMA folks are happy, and hockey and basketball. So volleyball is something that is now part of step 3. And we really have no idea what happens after step 3. We wanted to stress this, actually. That's why we kept this slide in, because we're like, we don't know. The same as we hear news when you hear news. So we don't know like how much more restrictions will get released in the, I mean, obviously our numbers are looking great, but we don't know. So right now we are planning, and it's great because for volleyball, indoor, outdoor, you can plan full steam ahead with volleyball action happening, just with a lot of safety things. But it is nice to be able to play. So I had this up here just because it really keys in on our vaccination rates and where we're at. So pretty excited to say Ontario is already second dose vaccinated. We're over 60%. That is part of the next restrictions that we don't know what they are, that may lead into some further easement, is once every public health region has reached a fully vaccinated level of 70%. So really important to still encourage everyone to get their vaccinations. That's what's going to help us continue to move forward. Ontario's Recovery Act. This was really important in November 2020 when the Ontario government announced this. This act does provide the liability protection for our organization, for your clubs, for volunteers, everyone working within sport and other sectors. But as long as an honest effort is made to follow the public health guidelines, obviously our return to play protocol, the government regulations, it does provide a liability protection. But on the flip side of that, keep in mind that if there is gross negligence, and if you do not maintain all of the best efforts to protect and to keep people safe, that their legal action can be taken against you. So if you are not following the laws and the OVA return to play protocols, you are not protected under this act or by insurance, and so you could be personally liable if someone does sue you. So this is where we're back to, please follow the return to play protocol, keep yourself safe and those around you, and let's keep volleyball going. And as we get into that, it isn't easy. there is, I really commend everyone that has been jumping in and really obviously joining our town halls to learn more about it. But I know there's been so much effort to learn about the requirements, to keep people safe, to create safety plans, and really make sure that we're able to get volleyball playing and keep volleyball playing. So not only do the government regulations have to be looked to, obviously each public health authority is also, they can add further rules. So you always have to check with them. You want to make sure that you can operate in your region. The insurance and legal is another component, and facilities and permit issuers. There's another requirement also that they could layer in. And then we are part of the sports system with Volleyball Canada, and we are in compliance with them as well. So how do we comply? Obviously follow the return to play protocols. The return to play protocols are all of the government regulations for sport are incorporated into those protocols. So keep in mind there could be other government regulations that also need to be followed in general outside of sport. Follow all public health regulations, facility regulations, and always check as they change quickly. As we know from over this, I don't want to say how many months. There's also a risk mitigation assessment checklist. We always recommend completing it, making sure that you have, there's just maybe some things that you missed. There may be some things that you haven't considered, and what other safety things that you could do to help mitigate any risk for your participants. So that is can be found online. Create your club return to play protocols. Obviously, the OVA return to play protocols are the main bulk of that, but you may have further things for your club. Post it online. Create and share your safety and response plan with all your participants and with your facility. We talk about posting it online. Make sure that your safety and response plan also is available to your participants on site. And always obtain permits, even for outdoor activities. So obviously for indoor activity, you need your permits, but also for outdoor. And that's an important piece, because if you do not have permits and you're just showing up somewhere to play, you're actually trespassing, which is, again, not a great thing when you would be considered to be not legal, and it would be illegal, and then there wouldn't be insurance coverage available to you. Your club should be registered and has acknowledged that they're following all return to play protocol. That's a form found in MRS. Also, individuals that are members will have signed off on their COVID waivers. So if they're in MRS, those waivers are complete. If you do have any non-members participating, make sure that you do have them sign off on a COVID waiver. Again, that can be found in MRS. So you want to make sure that you keep those on file, and you are able to have all participants complete those waivers. You have an education plan for your participants, your coaches, that's completed. And very, very important, obviously, is the daily health screening and the contact tracing that we've had to do forever. That, again, is still a very important piece and a requirement of the government regulations. And we'll get into more detail on the daily health screening questions in a later slide. But also, it's recommended to keep your contact tracing information for a month.
Joanne, quick question, just for surrounding club camps, like in the community that clubs might be running. Are they required to do the acknowledgement and COVID waiver for those athletes as well that are maybe non-members at the community level?
They're operating, sorry, I missed the first part.
Yeah, it says club camps for the community that the club may be running.
Yeah, you definitely want to have the COVID waiver completed. So they've acknowledged that there's a risk from, COVID.
And Kelvin, you can find that. There's a template of that on the OVA website under the COVID return to play section that you can take and tweak to make sure it's covering off your association or whoever you're running those camps for.
you may, if you have it, you may have already incorporated it into your waiver, but just make sure you have the COVID piece in there. That was good. I was ready for a break. Okay, so getting into some more rules, and I apologize, this is a lot. It's a lot of information. So as Alicia said, she's good at throwing in the questions as we go through. So indoor and outdoor volleyball is permitted. So that we're excited to add indoor in here. But keep in mind, physical distancing is required. Indoor, outdoor, doesn't matter where, physical distancing is still required, 2 meters, all individuals. The exception comes that athletes, while they're playing the sport, they may breach the physical distancing. So only the ones that are in action of playing. So even once the athletes are not playing, they leave the court, they need to make sure they maintain the physical distancing. So this is something that is in an overall piece that is just still required across, like any easement that's happened of any of the regulations. Physical distancing has stayed, but there's a few exceptions in team sport, and sport is one of them. So physical contact is only permitted during the play, and it should be incidental. There should be no deliberate contact. So still no high fives, backslaps, like all of those things. I know it's really hard. The kids love to cheer. They love to do that, but we do need to make sure that we limit the contact, because the physical contact is only allowed during the action of play. So that's back to the next point of all individuals must respect the physical distancing while off court. Within our province, we have no travel restrictions. So you can move to different regions. There is no limit on length of the training or competitions. And also a safety plan is required. So this is one of the changes in the government regulations, if you were with us in step 2, that this came in, where before the facilities, the venues, they carried a lot of the burden of the safety plans, but now it's actually the permit holders, and it's the groups that are coming in and renting the facilities and using the facilities. They're, in order to go and have volleyball in that facility or to have a permit to play volleyball, you must have a safety plan. So again, we have another slide that gives them all the details that are required in a safety plan, but you must have one or you will not get your permits. So that's one thing. So running into the fall and you want to jump in and you want to get all your indoor permits, and I know a lot are even going to be operating in August, the safety plan is required. And the OVA, we don't have a mandatory vaccination requirement in order to participate. It is, of course, highly recommended to keep yourself safe and everyone else safe. Capacity sizes. Physical distancing must be maintained at all times in order to determine the capacity size for the venue. So you still have to be able to maintain the physical distancing, but then they have some capacity numbers related to outdoors, 70%, 75% of the capacity of the venue. So there's a calculation if you need to, but capacity limits are determined by the facility. And so always check with them what is the capacity limit for the venue or the facility. And that capacity limit must be posted. So if the facility or the venue is not posting the capacity, make sure as the permit holder, you're posting that. As far as for sports leagues, they have not put a cap on how many can participate in the sports league. So you can go back to your capacity sizes and you can run based on how many courts you have and how many people fit in the venue, always maintaining 2 meters physical distancing. And it's nice because that means then those sports leagues can cross over and have playoffs and different things, but just keep in mind, you just have to check with the facility on the capacity size. This was another piece that we had a little cheer when we read this in the regulations. They've specifically put in that schools and private schools may rent for sports. So awesome little tidbit that was added in here. So this is something where I know some school boards were not wanting to rent or private school because they thought that sports weren't allowed, but it's specifically stated that they are allowed and that they can happen on their premises. So schools and private schools. Indoor, it works the same as outdoor, but it's 50% capacity. So again, confirm your capacity limit with the venue facility, always post it. And even the sports leagues indoors have no caps. So you can run that league to the capacity of the venue that you're operating it out of. And again, the recreational amenities can be rented out in schools and private schools for both indoor and outdoor. Athletes per court. So for smaller courts used on outdoor, we do require that only 4 participants would be active at one time on a 16x8 or an 8x8 side for outdoor, and up to 6 if you're playing in a 6 versus 6 on a 9x9 or 18x9 court. And then in indoors, same thing for the 8x8 court, the smaller court. We now have some volleyball and some other stuff that's going to be happening on 4v4. So those are on a smaller court. And then the active participants indoor, we recognize that there's a libero. They would be considered active. So they're not throwing their mask on and off when they're running on and off. We don't expect them to carry their mask as they're running, but we do want them to try to be able to maintain the 2 meters physical distancing. They don't have their mask on, but keep in mind that anyone sitting on the bench would have their masks on because they're not active. But the libero and the 6 people on the court would be active and would be able to remove their mask during play. It is recommended we keep it on, but they can. Spectators. Well, this is a fun one. So there's now a large increase in the number of spectators that are allowed, which is exciting. So outdoors, if there is a designated seating area, it's 75% of the capacity. It can go all the way up to the 15,000. So can't wait to have a great big beach volleyball game with that many people. But these are just the rules. And then the 5,000 is when it's a non-designated seated spectator area, but always the 75% capacity for outdoor. Very, very important though, all spectators, so anyone in attendance at your venue, at your event, must be wearing a mask. So this is a very important piece, and Alicia did a very nice bold for me, new in Ontario regulations. This is, we're gathering a lot of people. We're at an interactive activity. Masks must be worn. The only exception is the athlete while they're in action can remove the mask. So this is outdoors as well for a spectator. Indoors, the capacity levels are just lower. It's 50% or the 1,000, whichever is less. And then a calculation if there is no designated seating area. So again, that would all have to be posted by the facility, determined by the event hosts, and masks are required. So let's get a little more detail into the mask usage. Masks are required to be worn by all individuals, participants at all times for indoor. The exception is, as we've been saying, the athletes during playing on the court, they can remove their mask. We are recommending that they do keep their masks on. There's nothing that says, the government regulations do allow masks to be removed during sport play. We do have lots of studies, we have some studies, and we have the research that was done as earlier in this pandemic. We had indoor activity with masks happening. So there has been more and more research done. The athletes are safe to participate with their mask on, but it is not a requirement. Outdoors, also masks are required to be worn by all individuals, participants that are at the venue. Again, athletes while on the court during their training and competition may remove their masks. We do recognize that at times there's some heavy rain or some other difficulties. A mask gets completely wet. Obviously, temporarily, you can remove your mask for health and safety. Please don't drown. So just keep in mind, you must remove yourself from any other people and be 2 meters physically distanced to remove your mask. There are some exceptions to not requiring a mask. Keep in mind that medical documentation to support any of the exceptions are not required. So just these are the same as what we've had before. If someone's under 2, there's medical conditions that inhibit them from wearing a face covering, or if they're not able to remove their masks themselves, and if there's any accommodations from the ODA or the human rights. And all that information, again, the links are in here, they're on our website, so if you need further information. Oh, the safety plan. So the safety plan, as we mentioned before, the safety plan is required in order to have our sport activity. In order to have volleyball, in order to get your permit, you need to have your safety plan. The safety plan must cover off all this big list of things that we have. So this is the screening measures, the physical distancing, masks, how you're going to clean and disinfect the equipment, any other PPE that's required for people to wear. There has to be very clear instruction and direction on how preventing of gatherings in crowd is happening, along with the action plan to how would you dissipate a crowd if it did happen. So if there's, how are you going to control that crowd? If you do have athletes checking in, or they're, you know, there's a line that they need to stand in, you do have to make sure that you have that area spaced out, as we've all seen, right, in the grocery store, like our 6 meters and don't stand here, stand there. So just make sure that your safety plan deals with all those situations, and obviously then also mitigating the risk of the interactive activity of volleyball being played. Utilize the OVA return to play protocol, and then any other things you want to add to that. So we do recommend that you combine your club response plan with the safety plan. The safety plan must be provided to the venue prior to getting your permit, and it has to also be available to anyone participating. So anyone that's going to participate in your event, it's available on site, it's available on posted on your website, have a printed out version. Just make sure it's available for anyone that would like to see it. And there's a template available. See Appendix M. It'll give you, it's outlined, templates there. I know it sounds like it's a daunting task, but it's actually, a lot of it is covered off in the return to play. And a lot of you, because you have been operating, you have already covered off a lot of these things in order to operate previously. Now you just need to have it in one plan that's available for people to view and for the facility to have, so they understand a little more too about volleyball. Oh, daily health screening. So this is under Appendix F. So there's lots of appendices. So if you are looking for something, look to the appendices because there's always more detail. Adults use the Ontario screening questions for the workplace and employee. They're constantly being updated. So the links are there in our appendix to find them, but you can also find them on the Ministry and Health website. And the children and youth use the school screening tool. It is no problem to use your own mechanism of completing the health screening, like form stack or a different piece. Just make sure you update your questions, because as we're going to talk about here, is there are some exceptions to vaccinated individuals that they can still participate, that they will pass screening in some situations if they have been fully vaccinated. And I did want to run through those in detail, even though there's quite a few, but it's important. This is another reason why it's like if your athletes, your coaches, if they're vaccinated, they will be able to a lot easier get through screening as well. So if in the last 48 hours someone received their vaccine and they have a few of the mild symptoms, they can still participate, because it says right in the questionnaire that's on the ministry, they can answer no. If anyone that you're living with has some of the COVID symptoms and they're waiting for a test, if you're fully vaccinated, you can still answer no. The other one is also on the travel. So if you are exempt from the federal quarantine requirements, you also get to answer no. That's another new one that was added in the last 14 days. A close contact has COVID or is getting tested, you can still answer no, along with even your COVID alert exposure. if you have, if you are fully vaccinated, you could also answer no and still participate. Any questions, Alicia, or we're getting there? Okay, event setup. Okay, so as we said, that you must make sure that your capacity limits are posted. So please make sure that you know for your venue, your capacity limit, but also that you post it. If you're using a tent, make sure that 2 full sides are open. They're not blocked by any walls. And any tables that you're setting up for athlete check-in or anything, make sure they're spread out, make sure, or that you've put plexiglass, a lot easier, just make sure they're distanced 2 meters. And then, as we were talking about in the safety plan, making sure that you're not gathering people. If there's a check-in area, stagger the timing, make sure there's enough space that there's the 2 meters physical distancing can still be maintained. Make sure if you have to organize the flow of the exit and entry, just those are all the things that you want to make sure for your venue that keeps the physical distancing maintained. And again, event hosting guideline tips, Appendix K. This has been a hot question, so we just thought we'd put the slide in. We thought we would just, let's just hammer this one out because it's a question that comes up, and it's a question that has been talked about a lot amongst other sports. What are people doing? Keeping an eye on who's requiring vaccinations, who's not. So that's the question, vaccinations. Can it be mandated? Well, obviously COVID is a risk. So for a health and safety of all your participants, vaccinations is a way to keep your participants safer, but it's one piece of it. So you do have the rationale to be able to ask, is someone vaccinated or not? But then that turns into a lot of challenges. So personal health information is confidential. So how are you going to collect that information safely? How are you going to keep it secure? How are you going to make sure that you've safely destroyed that confidential information when the time comes? Obviously, there's an administrative burden to checking all of the vaccination levels. So requirements. What are you going to do if the individual refuses to provide their health information because they can? They're going to demand exceptions. What would you do with that? What would you accept? What accommodations would you make? So those are all things that would have to be decided, and how you would deal with it. And then just a couple other points that I would consider is society. It's not mandatory. So then it's going to be sure for the health and safety of your participants in an interactive activity, you can, but you have all those other challenges to deal with. And then you also would want to be aware, making sure that a bullying scenario isn't coming out of that. It's just an awareness thing of that. Oh yeah, that could create some animosity amongst participants and individuals. So just keep those in mind. But those are really the challenges. So even if you found out that someone wasn't vaccinated, what would you do with that? What would you decide? Would you say that they can't play on that team? Would you? So that's the piece where you would have to want to make sure that you would have a full protocol. And vaccinations is also any of the organizations that are requiring vaccinations, it is part of their overall safety plan and their mitigation of risk. So it's not just a vaccination that's required. There's every other safety piece that is in place to make sure that the individuals are kept safe. And the vaccination, they require education on it, why it's a good idea to be vaccinated. Here's where you can get vaccinated. So there's still other steps that they do encouraging the vaccination before they just say it's mandatory. And no matter what, it's still part of your overall safety plan that has to that you've created, you have to comply with all the government regulations of the physical distancing, the masking. All those things still have to be complied to, even if vaccination has been taken care of.
Joe, quick question that just came up from the chat. Is asking for vaccination proof any different than asking about allergies of athletes or participants or coaches?
Great question. It's still health information. They may find it more sensitive, and that would be that individuals, whether or not they find it more sensitive or not. But it is health information. So just keep in mind, any personal health information, you always need to keep it secure, confidential, secure, all of those things.
Okay, thanks.
No problem. Do we have any other questions? Oh, okay, that's good. Okay, Alicia, this is where I can say, okay, that was a lot of coverage of information. Did I miss anything that you can think of that you think would be helpful to kind of clarify or add some more info?
No, I think you got everything. You know, you really hammered home in the importance of the safety plan. That's really what's allowing us to be where we're at. Sorry, it's another question pop up and it distracted me. You know, that was added in step 2 and they've just kind of added on to it. We've added a few more bullet points in the step 3 regulation. So that's all in the policy as well. All of this information is on the step 3 regulations that are on the OVA website under return to play. So, you know, go through that. I'm sure you all have already, but it is there for you to look at. So I think you got everything, Joe, in terms of the main changes.
Okay. I will just briefly bring up then the chart that we love to use. That's what helps us. So I'm hoping you all saw the story that got posted about the document release of the stage 3, and that's how you ended up on our town hall. So you probably already know, but this is a great reference guide. Just what is the quick snapshot. I'm showing the chart, right, Alicia? Yeah. Okay. So just to have from step 1 to step 2 to step 3, here's what's allowed in step 3, and it just covers off all of from indoor to outdoor, and it's a great reminder to just have that. And these are things. This is for example, when we say an education guide, this is something that can be shared with your participants. Along with anything particular to your venue. So this is a good way to quickly share the information and make sure people know what's allowed and what's not, and that this is how step 3 rules relate to volleyball. And then I will take us back to, you have your future town halls. Bear with me as I get there.
While you're opening that up, there was a quick question unrelated just about the early contact initiative and where that information is on the website. So Dylan, our communications coordinator, and the youth comp staff have been working feverishly to get that updated. We're just finalizing a manual to go along with that page of the website. So the goal is to have everything live by this Friday. So we will have an email blast going out to everyone when that is live and good to go.
Awesome. Okay. Do you want to take us through the next town hall?
Oh, for sure. So we are switching it up. Wednesday, August 11th is our next town hall session. I can't believe it's already going to be August, but the club administration for the 2021-22 indoor season. Also, hopefully at that time, we have more information from the government of what the next step or stage or whatever they're going to call it looks like to help us with things. But we will be going over everything from membership, insurance, registration fees, policy changes, the membership registration protocols, and what is related to the clubs and club forms and all that fun stuff. So everything administratively that the clubs would need to know about for the upcoming season will be touched off on this presentation. Once again, it's a registration through the Zoom link, and you can click on that. It's also on the website, and we look forward to discussing everything, you know, positive, fingers crossed, that will be coming in the new season. And if you have any other, you know, topic requests that you have of the OVA staff, just email me, alittams@ontariovolleyball.org, and we'll make sure we get things addressed.
Awesome. Thank you. Well, there's any questions?
Oh, we had one more question just pop up. Is the MRS ready to accept registrations for next season, coaches, players? Joe, do you have more info from Jen on that as of yet? It will be, trying to remember.
Yes. I'm going to go with yes. We are going to clarify all of the process and dates with that on August 11th.
Perfect.
Yeah, but that is what was getting looked at. It's interesting because we'll make sure that the coaches, referees piece, because we were actually focusing on the athletes.
Mm-hmm.
And for coaches, just keep in mind there's the coach eligibility acknowledgement to be completed as well, that has the screening forms.
Awesome. Sorry, Calvin, don't have an answer for that one. Wait till the 11th. Dun, dun, dun. All right.
Yeah.
I think that's everything for us tonight, Joanne.
Yeah.
You got
Thanks
through that.
For bearing through the many slides of lots of words and rules. Unfortunately, COVID brings lots of rules.
Awesome. If you guys do have any other questions, just email us at any time. You know, we're always here to answer anything that you may question or have concerns about. So thank you for attending and spending your Tuesday evening with us. Have a good night, everyone.
Have a great evening.